You know, in less than an hour, you can be on the mountains, at the beach, or in the desert. We'll be going out to those freeways today to meet the movers, the shakers, the leaders, and the visionaries. So, come on along as we head out on another edition of Heartbeat of the City.
This is Heartbeat of the City, the television show that focuses on companies and their CEOs. They are the ones who are making news in science, medicine, technology, and business.
For over 10 years, our highly acclaimed show has aired coast to coast and has spotlighted more than 1,000 leaders and innovators who are impacting the lifestyles of their cities.
Today, we bring you a special segment of our show that takes a look at one such innovator.
The filmmaking taking place in some of these New York buildings is not a major Hollywood production. Now, how do I know? Well, for one thing, the camera's much too small for that. Another reason is the actors are company employees, not movie stars. And still another reason is the camera's shooting their mouths, not their faces. So what's it all about? Well, I can give you the answer in 2 words. Oral screening. What is that? And what does it have to do with videotaping employees in an office? Well, to find out, we've come to the offices of Beekman Dental, and I'm here with Dr. Howard Krinick. Now, doctor, you are a dentist. What are you doing videotaping people in offices?
We're doing corporate medical screenings in corporate medical departments.
And what does that mean? What does it involve?
Well, this is our dental camera, our video camera. This is the monitor we see our images on. Right. And we come into the offices of corporations and we see patients about every 10 minutes. We see 40, 50 patients in a day. And we videotape their mouth. This is how it would go. Open.
And we look around patients. What are you looking for?
We're looking for different signs of dental disease or signs of oral cancer or anything that might be of interest to the patient. And we capture these images and then discuss what we see with the patients.
And patients, and you know, what kind of companies do you do this for?
We've done it for companies like Citibank and the Federal Reserve Bank of New York, Chase Bank, we've done it for.
So this is a free service offered by,
yes,
by your dental office? And I would assume then the patients get a chance to learn about problems they may not even have known anything about, right?
Yes, this is a very non-invasive way for a patient to come in and to find out what their dental needs are exactly without the ominence of perhaps the dental office.
And once they find out, once you know what the problems are, then what do you do?
Then they can come to any dental office or our dental office, which is usually in proximity to their company, where we have a whole range of dental services to take care of their needs.
Well, it's really a very unique service and a unique idea. So the next time you see a camera in an office, it may not be a Steven Spielberg production. Instead, it might be a production by Beekman Dental, where employees are finding out about problems they have that they didn't even know about.
Well, we're back at the studio. Our reporter has been out on location covering a Heartbeat of the City news interview.
It's an important interview, but one that raises a lot of questions. Our viewers want more answers.
So stay tuned as we go back to continue the interview.
Because this whole subject of oral screening is so novel and seemingly so beneficial to company employees, we've decided to extend our visit here at Beekman Dental and continue our conversation with Dr. Krinick. Let me ask you, Doctor, how did this concept come into being? Is this totally your idea?
Well, we've been in dentistry down here for 15 years, and being in a very corporate environment, the worst thing that we found a corporate executive could have would be a dental emergency with their employees. It would take them away from their job place. It might make them inefficient at the workplace for days while they were waiting to go for an appointment. So what we did is we decided that we'd bring our dental offices into the corporate environments.
Well, that's really, it is unique. Does anybody else do this, to your knowledge?
Not that I'm aware of.
And your equipment obviously is very portable, very easy to move, right? What has been the reaction, and when you started this, how did the companies react and respond to you?
Well, at first, companies are somewhat hesitant to allow professionals into their medical departments, but most corporations do have wellness programs, and they like to bring health professionals in to do preventative type of medicine and dentistry, in this case, for their employees. So the corporate wellness directors are open to these type of things, but it is quite an operation to get this over there so that there may be some hesitation, but it works very well, and the call for it is very great.
So explain to me logistically how it takes place, what really you go through.
Medical departments put out a flyer advertising the fact that they're going to have a dental screening, and employees call from all over the corporation. We just recently did one at Citibank where we had available about 50 slots for people. We ended up expanding that to 70, and we had to turn 70 more employees away, and they only publicized for about 2 hours. Because dentistry is an area that most people are very needy in.
So what happens now? A typical employee, a secretary, whoever would come in, how long do the exams last?
We spend about 10 minutes with each patient. We begin by doing an oral cancer screening where we do a lymph node exam on them, and then we do a visual examination using our camera of their oral cavity, looking for any abnormal growths. Then we go on to looking at their teeth and their gums, and we try to identify the most important things that we see in the patient's mouth.
And what is the benefit of having the video? I mean, because the dentist, you as a dentist can look in a patient's mouth and can see problems. Why the video?
Well, in the old days, when we didn't have the technology, a dentist would have to basically visualize the entire mouth through a very small mirror, and then perhaps the most they could do was give the patient a hand mirror and try to match up mirrors to see something. Now a patient can be part of the choices that are involved in dentistry today, because they can actually see for themselves in live action video what their problems are, so that they're part of choices that are made to help improve their health.
And in examining these patients, did you discover problems in many of the patients?
Sure. Most patients we see know that they need to go to a dentist, or perhaps some people want to make sure their dentists are doing the right thing, and they hear about this technology which opens their eyes up to a whole world that they haven't seen before.
So the bottom line, and what is the general reaction from everyone involved?
The general reaction is very positive.
Both from the company point of view and from the employees?
Right, and from the medical departments. They're all very satisfied with the programs, the way they go.
And there it is, a timely news report that represents some of the developments that impact life today.
It was another focus of Heartbeat of the City. See you next time.
When we appear again on your television screens with more stories that are truly the heartbeat of your city.